So, is it wise to have my primary care doctor via telemedicine only? Hi, I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. So, first of all, I'd like to talk about what is telemedicine, because to get to the point that is it wise to have a PCP as my telemedicine only, I just want to go back a little bit and tell you what is telemedicine. So telemedicine and telehealth has been, you know, interchangeably used. So the history behind it is telehealth. It started like way back in the late 1950s. At that time, telehealth was more for mental health. Psychiatric patients could have remote uh, doctors taking care of them. And ICU patients had the benefit of remote experts listening to their case from faraway place, and also getting them into the when you have the doctors having a conference, they are not limited by the ones present at that time taking care of the patient in ICU. They would bring in experts from whatever place they were, and the patient would benefit from the care they decided the patient needed that time. So that was the way in the beginning, when telehealth was more for places that had the technology to transmit the patient's information electronically. And then later, it started with the robotic surgeries, and then some doctors doing surgery from another place than the patient. So very intriguing and very fascinating aspect of telehealth. So at that time, when started telehealth, we didn't have the technology we have today. And then as the technology started getting more sophisticated, more expansion from telehealth was seen, and patients got the benefit of it. So monitoring patients remotely is still fascinating. I remember some time ago, it's not even so recent, patients with cardiology issues, they would go home with monitors that would at the same time, on real time, telling the heart rate, heart rhythm straight to the central uh, command at the cardiologist's office, and the cardiologist could have an evaluation of the patient's condition and give treatment right away. On the field of sleep disorders, which is my specialty, I have seen amazing things with the CPAP treatment, which is for sleep apnea. The patient would use the CPAP at night, and the machine was remotely with wireless technology, getting the whole information to the lab and to the doctor to have adjustment on the patient's treatment. So we would know if the patient had a sleep apnea, how many, oxygenation levels, and so many other information that was very helpful. And this is all part of telehealth. So telemedicine is a part of telehealth. So telemedicine became very popular with the pandemic. So 1 year into the pandemic, most people have heard about telemedicine or have used telemedicine because it was just a better way to get care without exposing themselves to doctor's office full of infections and COVID. So from the from 2020 until now, we have seen an increase in patients' understanding of telemedicine and seeing the benefits of telemedicine. So, if you have a tablet, a laptop, any smart device connected to the internet, you can have a telemedicine visit, and it can be quite efficient. So, let's talk about advantages and disadvantages of telemedicine. So, yeah, we do have disadvantages, right? So, advantages of telemedicine is that we can treat 90% of acute and chronic health conditions. Pretty much 90% can be treated remotely. Cost effective, it is efficient. And if you have, hypertension, diabetes, any cardiovascular disease, and things that you need more frequent follow-up. So you don't want to have, follow-ups that are difficult for the patient. So you go ahead and have the follow-up. Very, very, very easy to do the follow-up through telemedicine. It's convenient for mental health visits, potentially increase compliance and improving outcomes. It's convenient for geriatric patients and for disabled patients. Some patients, they have problem with bladder incontinence, can be bowel incontinence, problems with transportation. So it's so much easier to have the telemedicine visit. Not for every condition, but in some special cases, it's just somebody to help them connect to the technology, and that's it. They can have their follow up without much trouble. Also, for patients with difficulty with child care. If they don't have transportation, if they don't have child care, it might be very difficult. So they need to have that kind of option, and that's very convenient. Also, more flexibility, because if you go to office in person, you may lose like half day of work. And if you have telemedicine, you don't need to lose work. You just go and do at your convenience. At FuelWell Telehealth, we have easy access. Our providers are available 7 days a week with extended hours from 7 a to, I'm so sorry, from 6 a.m. to 10 p.m. So it's extended hours. And also the providers speak your language. You can have people that are with difficulty with the English language. We have providers speaking Portuguese, English, and Spanish. So that's also an option. What do we treat? We treat COVID, acute and long haulers infection, vaccine counseling, because we have access to Florida shots. So that will help to get your vaccinations updated. We do mental health, anxiety, depression, panic attacks, those things we can help you with. Any yeast infection, birth control, menstrual issues, urinary tract infections, STDs, blood pressure, diabetes, thyroid, sleep apnea. We have on our website many accounts for you to see what we actually treat. So the wellness exam is really comprehensive, and we have a screening for mammograms, DEXA scan. We can have orders for Cologuard, for colonoscopies, ultrasounds, images. It goes on and on. But some things we do not treat. And it's important for you to know if you have an emergency situation, such as severe chest pain, difficult breathing, stroke symptoms, severe bleeding, serious injuries, you don't, want to seek telehealth, especially like a drug overdose, suicidal thoughts. So you don't, you cannot treat those. You have to dial 911, call an ambulance, or go to an emergency room as soon as possible. In some conditions, we may do a visit for you and still recommend an in person, depends on the situation. And we do not prescribe controlled substances. And actually, controlled substance cannot be prescribed via telehealth or telemedicine. And prescription that requires regular labs for to dosage them. We also need to have those labs before we can prescribe the medication. So disadvantages of telemedicine. It's important to be truthful about what is not appropriate. So it's not appropriate for all conditions and all patients. So if you do not have access to a smart device with internet connection, it's not for you. If you have difficulty navigating the technology and you don't have anybody to help you, naturally you cannot, take advantage of telemedicine. If you need a cardiac evaluation with electrocardiogram test, lab test that you need right away, any condition that you need to have, heart and lungs auscultation or measurement for any kind of oxygenation, not for you. If you need a neurological assessment, including checking reflexes and things like that, we don't do that over telemedicine. And also patients with diabetes that need a fit assessment for sensitivity, if they have any problems with neuropathy, we need to make sure that we do the proper assessment with the proper tools, and that cannot be done over telemedicine. You also need to keep in mind that disadvantages of telemedicine include the vulnerability of your privacy and security risks. Telemedicine platforms are required by law to have highly encrypted and all the compliance with HIPAA and all the cyber security. However, there is no 100% anywhere. So there is always risk, and it's important that you know. Also, technical difficulties during the consultation. If you lose internet connection, if your camera or your microphone doesn't work well, that could compromise the way the visit is done and even the diagnosis being appropriate. Some practices of telehealth have restrictions on any measurement. Like, if you have a high blood pressure and you take your own high blood pressure, they cannot count that as an assessment. For us, we teach the patient how to do the blood pressure measurement, and we follow up with the patients so we can see them doing the blood pressure and know that they're doing right, and we count that. Also, the disadvantage is that in person, sometimes we have incidental findings that can be very important for the patient, like a patient with a mole or something that he came for something else, but I saw something that looks suspicious. I sent to the dermatologist, and the patient has skin cancer. So that would be an assessment that could have been missed via telehealth. So some of those things are limited when you do a telehealth visit. Also, some offices, they draw their own blood and they do things that, telemedicine we don't do. And the one that is more important to me is the warmth that we have when in-person visit. I like to hug my patients. I like, to touch and to feel connected. And sometimes it's more difficult with the technology. So saying all of that, the question comes back. Is it wise to have my primary care doctor via telemedicine only? So the short answer is it's not for everyone, but many people can benefit from having a PCP via telemedicine only. You may have heard or may somebody, have mentioned about the saying from this physician from Canada. He lived in the 19th century, Dr. William Owsley. He said, very, very interesting, always listen to the patient. They might be telling you the diagnosis. So in medical school and nursing school, we learned that 80% of the diagnosis is patient's history. So I want to make sure that I listen to my patients really well, because by listening to the patients, all the symptoms that the right questions that I ask and what the patient tells me, I have a better way to do a good diagnosis and treatment. So telehealth, it's all about listen the advantage of having your PCP telehealth, because you can pretty much get all your assessment very nicely done. So one of the questions that came in is like, do I need to have two PCPs? No, you don't need to have two PCPs. If you have a telehealth primary care practitioner, that's your PCP. But most of my patients, they have in-person visits with specialists. So what I miss from listening to the lungs and the heart and the physical contact, I get through the visits that the specialist sent to me. So if you are female and going to a gynecologist for your pap smear, they're going to listen to your lungs and your heart, and then I get the visit, that the electronic medical records, and then we have that assessment. If you are male, you go to a urologist the same way. If you go to a cardiologist, you have the full cardiologist assessment. If you go to a gastroenterologist, so actually the specialists, we work in very good synchrony, so we can transfer information to each other. And if you need an in-person visit, we have partnership with some of our colleagues that have in-person visits, and we send patients to them for a specific assessment if necessary. So you're always going to be taken care of. One of the questions that we got here, do I need to have a blood pressure machine at home? We highly recommend that you have a blood pressure machine at home, even if you don't have problems with your blood pressure, because then you can check your blood pressure occasionally. If you do take medication for blood pressure, more important that you check your medication on a regular basis, so we're not missing any abnormalities. So yes. Another question here, what kind of people like PCP telemedicine? Some of my patients, they are busy professionals, busy people like business owners, stay at home moms and students. They are very busy and they don't have time to see their primary doctor in person, because like we said, you waste a lot of time just getting to the office, waiting, and pretty much like half a day, sometimes even more. So any person that feels that they are so busy they cannot make the time to see their doctor in person, we are a good option. And I have seen patients without a wellness visit for 4 or 5 years because they didn't have time. So having your PCP telemedicine may improve your assessment for screening of cancers and other disease, because then you're doing it. So those kind of patients are very appreciative of the option of telemedicine. So the other question is very interesting. What is included in the telemedicine annual physical? So I don't know if you have paid attention to this before, but when you go for an annual assessment, a wellness visit, 90% of the times, or maybe 95% of the time of the visit is history, and maybe 10% or 5% is actually physical examination. So we do this 90%, 95%. So what is included? We check for high risk disease. We check for we have a very comprehensive medical history, family history, because it's very important to know your risks. and we monitor progression of your health, any degenerative disease and health conditions we'll monitor for you. We'll discuss your eating habits, any exercise regimen, and help you to develop a plan. We will do also orders for DEXA scan, mammograms, labs, any kind of images that is necessary. And many times, the vaccination is one thing that people miss a lot, because sometimes even in the in-person visit, they don't get to check, all the vaccinations. And we have a straight Florida shots. So electronically, we can check your vaccinations. Doesn't matter where you got them, and we know what is due, and we'll make a plan with you and send you to a local pharmacy to get your vaccination. So we do that very thoroughly. Another question that came here: how do I do my tests? So you do the same way that you would do an in-person visit. We would prescribe the test necessary for you, and you schedule to go to a lab or to an image place that you can do whatever screening necessary. If you have health insurance, you can charge your health insurance for the exam as well, and usually they pay for screening tests. And the last question that I have here: how often do I need a physical? A physical for wellness is done once a year. If you have problems with chronic disease, you may need more closer follow-up. But if you don't have any problems, once a year you do your screenings, your labs, everything is good. You don't need, much follow-up. And if you need a treatment for acute illnesses in between your physicals, you always can count on our telehealth practitioners as well, because then it's easy access. And just remember that you can always keep in touch with us via texting, or sometimes we do quick phone calls as well in between visits. And that's our VIP treatment. Remember last week we talked about concierge medicine? We pretty much offer you concierge medicine without the monthly membership fee. So we are here for you. We are happy to take care of you as your primary care practitioner, or just for acute visits, whatever you need, we are here for you. I'm gonna let you subscribe, put a like on our videos, and share with your friends. And I thank you so much for your participation and for your questions. And I see you next Tuesday for our Q&A Tuesday. Feel well and be well.